The science of vaccines. Myths versus facts. Welcome to our channel, where we delve into the science of vaccines, dispelling myths and sharing the facts. Vaccines are one of the most powerful tools in modern medicine for preventing and controlling infectious diseases. They have played a critical role in saving countless lives and reducing the burden of illness around the world. However, like many medical interventions, vaccines have been the subject of myths, misinformation, and misconceptions. In this lengthy article, we will explore the science of vaccines and address some of the most common myths and misconceptions surrounding them. Before we begin, make sure to smash that like button and hit the subscribe for more exciting content. Myth 1. Vaccines cause autism. Fact. This myth is one of the most persistent and harmful misconceptions about vaccines. Numerous scientific studies and extensive research have found no credible evidence to support the claim that vaccines, particularly the measles, mumps, rubella, MMR, vaccine, are linked to autism. The origins of this myth can be traced back to a fraudulent 1998 study published by Andrew Wakefield, which has since been thoroughly discredited and retracted. Subsequent large-scale studies involving hundreds of thousands of children have consistently shown no association between vaccines and autism. The consensus among the scientific community is that vaccines do not cause autism. Myth 2. Vaccines are not necessary because diseases are rare. Fact. Some people argue that since many vaccine-preventable diseases are rare in developed countries, vaccination is unnecessary. This notion is flawed for several reasons. First, the rarity of these diseases is a testament to the success of vaccination programs. Vaccines have helped to drastically reduce the incidence of diseases like polio, measles, and smallpox. However, these diseases still exist in other parts of the world, and global travel can quickly reintroduce them into previously protected populations. Additionally, if vaccination rates decline, these diseases can resurge, as seen with recent outbreaks of measles in some countries due to vaccine hesitancy. Myth 3. Vaccines contain harmful ingredients. Fact. It is a common misconception that vaccines contain harmful or toxic ingredients, such as mercury and formaldehyde. In reality, vaccines are rigorously tested and subject to strict safety regulations. Thimerosal, a mercury-containing preservative, was previously used in some vaccines, but it has been removed from most childhood vaccines. Since the early 2000s, and numerous studies have shown it to be safe in the small amounts used in vaccines. Formaldehyde is used in the production of some vaccines but is present only in trace amounts, well below the levels known to cause harm. The benefits of vaccines in preventing deadly diseases far outweigh any potential risks associated with these trace ingredients. Myth 4. Natural infection provides better immunity than vaccination. Fact. It is sometimes argued that natural infection with a disease provides stronger and longer-lasting immunity than vaccination. While it's true that natural infection can lead to immunity, it often comes at a significant cost. Many vaccine-preventable diseases can cause severe illness, complications, and even death. Vaccines are designed to stimulate the immune system in a controlled and safe manner, without causing the full-blown disease. They trigger an immune response that leads to the production of antibodies and memory cells, providing effective and long-lasting protection without the risks associated with natural infection. Myth 5. Vaccines overwhelm the immune system. Fact. Some concerns have been raised about the number of vaccines children receive, suggesting that they might overwhelm the immune system. In reality, the immune system is exposed to countless pathogens every day, from bacteria and viruses to environmental toxins. Vaccines contain only a small fraction of what the immune system encounters regularly. Research has shown that the immune system has the capacity to respond to the antigens present in vaccines without being overwhelmed. The vaccine schedule is carefully designed to provide optimal protection while not overburdening the immune system. Myth 6. Vaccines can shed and infect others. Fact. Another common myth is that vaccines can shed and spread the disease to others. This misconception is often associated with live attenuated vaccines, such as the oral polio vaccine. While live vaccines contain weakened forms of the pathogens, the risk of shedding is minimal, and any potential transmission is unlikely to cause illness in healthy individuals. In fact, these vaccines play a vital role in achieving herd immunity by helping to reduce the spread of diseases within the community. Myth 7. Herd immunity isn't real. Fact. Herd immunity, also known as community immunity, is a crucial concept in public health. It refers to the indirect protection from infectious diseases that occurs when a sufficient percentage of the population becomes immune. Either through vaccination or previous infection. Herd immunity can provide protection to those who cannot be vaccinated due to medical reasons, such as allergies or compromised immune systems. Achieving herd immunity through vaccination has been successful in controlling or even eradicating diseases like smallpox and nearly eradicating diseases like polio. Myth 8. Vaccines are only for children. Fact. While childhood vaccinations are crucial, vaccines are not just for kids. Vaccination is a lifelong process that can protect people of all ages. Certain vaccines, like the flu vaccine, are recommended annually for adults and seniors. Vaccines against diseases like shingles, pneumonia, and tetanus are important for adults as they age. Moreover, adults may need booster shots for vaccines they received as children to maintain their immunity. Myth 9. Vaccines can alter DNA. Fact. Some individuals worry that vaccines can alter their DNA, which is not supported by scientific evidence. Vaccines work by introducing harmless pieces of the pathogen, like proteins or genetic material, to stimulate an immune response. These components do not integrate into a person's DNA or change their genetic makeup. Vaccines trigger a temporary immune response that helps the body recognize and fight the pathogen if it's encountered in the future. But they do not modify the individual's genetic code. Myth 10. Vaccines are profit-driven and not trustworthy. Fact. It is true that pharmaceutical companies produce vaccines, and like any industry, they aim to make a profit. However, vaccines go through rigorous testing, safety assessments, and regulatory oversight to ensure their safety and efficacy. The development and production of vaccines involve extensive research, clinical trials, and scrutiny by health authorities. Public health agencies and experts carefully evaluate the data to make evidence-based recommendations for vaccine use. The trustworthiness of vaccines is built on a foundation of science, rigorous testing, and the dedication of countless healthcare professionals committed to public health. In conclusion, vaccines are a cornerstone of modern medicine, playing a vital role in preventing infectious diseases and protecting public health. Misinformation and myths about vaccines can have serious consequences, including vaccine hesitancy and outbreaks of preventable diseases. It is essential to base our understanding of vaccines on credible scientific research and expert consensus. Vaccines are a testament to the incredible advancements in medical science, and they continue to save lives and improve the well-being of individuals and communities worldwide. If you find our videos informative, don't forget to share, subscribe, and hit the like button to support our channel.